The Rome Foundation has evolved considerably. It started actually very small. We decided we wanted to compile information about functional GI disorders, in part to preserve the field, to legitimize it. So we developed diagnostic criteria. From that point on, with Rome 2 and later versions, these criteria became more accepted. With that, we gained the interest of regulatory agencies like the FDA, who were interested in having a basis for selecting patients for clinical research. And that brought on more pharmaceutical companies. So from 6 pharmaceutical companies, we now have 20 who are sponsoring us because we preserved the field through our diagnostic criteria and recommendations. Another component to that was the expansion of our activities from just a book that identifies criteria and updates the field to more educational resources. We learned that the criteria are rather cumbersome for practitioners. So we developed a set of diagnostic algorithms which actually take the clinician through a pathway of diagnosis getting to the Rome criteria. In addition to that, we developed what we call the multidimensional clinical profile, which carries it from diagnosis to treatment. And with treatment, we actually use a more biopsychosocial approach, where we integrate not just the diagnosis, but the patient's psychosocial milieu, any physiologic disturbances, any biomarkers, their quality of life, and any subcategorizations that will help define treatment. So criteria is not enough. We have to move on to look at treatment applications that are multidimensional. Another change since 2010 was our effort to go global. And we have done that through involvement of our associates program. We have over 1,200 associates, our international liaison committee, of which there are 8 who are responsible for our educational programs in regions around the world. And with that, we develop workshops, seminars, we present at international meetings. And also important, we've incorporated their knowledge about functional GI disorders into what was traditionally a Western way. Let me give you an example. The term bloating is very common in China as part of the diagnosis. But in Latin America, there's no word for bloating. They call it inflammata. So we take that information and incorporate it now into Rome 4. In addition, we translate into many different countries. And most recently, we're beginning, thanks to Dr. Ami Sperber, a global epidemiology project that will involve over 25 countries with over 20 languages.